Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Spike over the septum, orbital and preseptal cellulitis soap. In this sketch, we'll talk about a couple of commonly confused infections around the eye, preseptal and orbital cellulitis. Both of these infections involve the tissues around the eye, but not the globe itself. Because these two types of cellulitis can present very similarly, it's important that we talk about them together to highlight their differences, so you can distinguish between the two in clinic or the ED. Let's jump right in. Real quick, let's talk some orbital anatomy. There's a thin membrane called the orbital septum that separates the superficial eyelid from the deeper structures of the orbital compartment, such as fat and the extraocular muscles. In this sketch, the orbital septum is represented by the septal net, dividing the volleyball court into an anterior side and a posterior side. So preseptal cellulitis is an infection anterior to the septum. Makes sense, right? It's also known as periorbital cellulitis, but for the rest of this sketch, we'll refer to it as preseptal. Throughout the sketch, you will see the features associated with preseptal cellulitis on or around the anterior side of the court. We've also emphasized the affected superficial soft tissue of the eyelid with this eyelid-like visor anterior to the septal net. In contrast, orbital cellulitis is an infection posterior to the septum. Remember, this is where the ocular muscles live, symbolized by the muscular arm spiking the eyeball behind the net. The extraocular muscles will be important later, so stay tuned. Throughout the sketch, you will see the features associated with orbital cellulitis on or around the posterior side of the court. In order to know how to treat these infections, it's important to know which bugs are common causative agents. Staph aureus is one of the most common causes of both preseptal and orbital cellulitis. You'll see that represented by our golden staff holding up the volleyball net. Staph aureus is especially common when there has been preceding trauma to the skin around the eye. Unfortunately, MRSA is becoming more and more common as a causative agent as well. MRSA is represented by the no mercy sign on the side of the court. The next common cause of both preseptal and orbital cellulitis is streptococci. Since strep is a gram-positive bacteria, you'll see it represented by purple gram-positive stripes over here on the beach towel. When the infection is coming from the sinuses, which is likely when there is a coexisting sinus infection, the bug is more likely to be strep pneumo or group A strep, aka strep pyogenes. You'll see our strep pneumo diver with his purple striped suit and the strep pi sitting on the sidelines as reminders of these two bacteria. Non-typable Haemophilus influenza, shown here by our H biplane with question mark banner, is an important cause of both orbital and preseptal cellulitis. Again, especially if in the setting of coexisting sinusitis. Hib, Haemophilus influenza type B, used to be a super important cause of both preseptal and orbital cellulitis, but thanks to vaccines, it's much less commonly seen now. It's represented by our H biplane with its no vaccines banner. Remember to consider Hib cellulitis in your patients who are unimmunized or partially immunized. Next, anaerobes should be considered as a possible cause of preseptal cellulitis, but are less commonly involved in orbital cellulitis. They can be seen especially if there is a history of chronic sinusitis or coexisting dental infection. Note how our preseptal volleyball player is wearing her gas mask, or sand mask. Finally, in patients with immune deficiencies like HIV, severe neutropenia, etc., fungi should be considered as a potential cause of severe invasive orbital cellulitis. Note the fungal mushroom sandcastle by our injured immunocompromised player on the orbital side of the net. All right, now that you've got the micro under your belt, let's talk about who is at risk for preseptal and orbital cellulitis and how it presents. Preseptal cellulitis tends to affect kids under 5. Note the number 5 jersey on our preseptal player here. Orbital cellulitis, on the other hand, can affect really any age kid, from the neonate to teenager, but is more often seen in kids versus adults. Interestingly, while orbital cellulitis can be seen at any age, it's twice as common in males than females. Notice our orbital volleyball player is a male.